Oxygen and oxygen equipment can be found throughout any healthcare facility. Many healthcare providers work with oxygen on a daily basis. Others use it less frequently. In either case, it is important to periodically review the basic principles involved in delivering oxygen therapy effectively and safely. Most healthcare facilities rely on a central supply system to provide oxygen. Oxygen stored in central supply units are distributed throughout the healthcare facility through a complicated piping system. The piping system will be designed in zones to allow for quick isolation of all areas if maintenance is required. In case of fire, certain zones can be isolated, thus preventing the problem from spreading to other areas in your institution. Every healthcare provider should be aware of the basic safety guidelines to follow when using a central oxygen supply system. Know where the main shutoff valves are for each work area. Only authorized personnel are allowed access to these valves, but everyone should know their location. And familiarize yourself with the type of quick connect wall outlet used in your facility. Immediately report any sign of a malfunctioning outlet, such as a regulator that does not fit securely or a broken flow meter. There are many situations that require the use of oxygen in cylinders. Everyone handling oxygen cylinders must follow certain safety principles. All oxygen cylinders will be green and clearly labeled. If the contents of the cylinder are questionable, do not use it. Full and empty cylinders should be appropriately labeled and stored separately. Cylinder valves should be fully opened when in use and fully closed when empty or not being used. Large cylinders have a protective cap that fits over the valve system. This cap should be kept on cylinders when moving or storing. Small cylinders without a protective cap have an outlet seal that must be removed before the appropriate regulator is attached. Cylinders should be properly secured at all times, either in a stand or in a cart to prevent them from tipping. The safe use of oxygen cylinders requires thorough training. If you have been trained to prepare a cylinder for use, the procedure is as follows. Remove the safety seal and locate the washer. If the seal is broken or the washer is damaged, get a new cylinder. The next step is to crack the tank. Using a wrench, slowly open and then rapidly close the cylinder valve to clean it of any debris. Inspect the regulator for any debris or loose pins. Apply the washer, making sure it fits securely. Apply the regulator valve by matching the pins to the opening and then fasten tightly. For large cylinders, the regulator is slightly different. Instead of two pins, there is a single large bore adapter that attaches directly to the cylinder head. Open the main cylinder valve with the wrench, turning it completely on. Determine the liter flow works properly. Then shut off the regulator until the liter flow is at 0. Shut off the main cylinder valve. Bleed the regulator by opening the valve, leaving it open until the indicator returns to 0 flow. Shut off the regulator valve. Remember, all valves should be closed when the oxygen cylinder is not in use, even if the tank is empty. When working with cylinders, never lean over the cylinder valve. A loosely fitted regulator can blow off a cylinder with enough force to cause severe trauma. In addition to oxygen in gas form, it is now often used in liquid form. If your facility uses liquid oxygen, you will be oriented to the use of the various portable oxygen systems. Each individual device must be operated according to the manufacturer's guidelines. The use of oxygen in any form poses a potential fire hazard. In an oxygen-enriched environment, once a fire does begin, it will spread quickly and be difficult to contain. Therefore, safety precautions are extremely important. Clearly identify areas where oxygen is in use. Absolutely no smoking can be allowed in the immediate area. The need for oxygen therapy varies from patient to patient. It's important to remember oxygen is a drug and should only be used when prescribed by a physician. To avoid any complications of oxygen therapy, be sure to always verify the physician's order for oxygen flow rate and method of delivery. There are numerous oxygen delivery systems, but the most commonly seen are nasal cannula, face mask, Venturi mask, face tent, partial rebreathing, and non-rebreathing mask. The two-pronged nasal cannula is simply a tubing with two plastic tips that insert into the nostrils. This device is the preferred means of oxygen delivery when moderate oxygen concentrations are required. It will deliver an oxygen concentration of approximately 25 to 45% with a 1 1/4 to 8 liter flow. Higher flow rates should not be used because they do not increase the delivered oxygen concentration, but merely cause irritation of the nasal mucosa. The simple face mask is designed to fit over the nose and mouth. Vents on the sides of the mask allow room air to mix with the oxygen. Therefore, the oxygen concentration will vary. Generally, up to 50% oxygen concentration can be delivered with a flow rate of 6 to 12 liters. The Venturi mask is similar to the face mask. It has larger holes and a special component that allows for the selection of an exact oxygen percentage. Each manufacturer will list the exact oxygen percentage delivered by a particular unit. The most common percentages delivered are 24%, 28%, 35%, and 50% oxygen. The face tent looks similar to a face mask, but is placed under the chin rather than over the nose. This device requires a special large bore tubing. The face tent offers an effective means to deliver humidity through an attached nebulizer or ultrasound device. Face tents may deliver oxygen concentrations of 30 to 50% with a liter flow of 10 to 12 liters per minute. The partial rebreathing mask is a face mask with a reservoir bag attached. The oxygen flow must be high enough to assure the reservoir bag is never collapsed. A partial rebreathing mask can provide an oxygen concentration of approximately 35 to 60% with a liter flow of 6 to 10 liters per minute. The non-rebreathing mask also has an oxygen reservoir. However, flaps on each side of this mask prevent outside air from entering, and a one-way valve permits inhalation of oxygen. This device can deliver high oxygen concentrations approaching 100%. Again, the liter flow must be high enough to assure the reservoir bag does not collapse. All of these devices can have humidification attached if ordered by the physician. You'll be oriented how to work with the humidification devices available in your institution. In addition to specific oxygen delivery systems, oxygen may also be delivered by a ventilator. Ventilators should only be cared for by individuals specifically trained in the use of each type of ventilator. All healthcare providers should be aware of their facility's protocol for calling for assistance if there are concerns about the ventilator in use. As a healthcare provider, it is your responsibility to follow physician orders for the delivery of oxygen therapy and to assure your patient and family members understand its importance. If you have any questions regarding a particular patient or a specific piece of oxygen equipment, consult with your respiratory therapy department. Oxygen is one of the most commonly used treatments in healthcare facilities today. It is important anyone working with patients who require oxygen keep in mind these basic concepts. Familiarize yourself with the use of your central oxygen system. If you use a cylinder, always stand to the side of the cylinder, never lean over the cylinder valve. Carefully stabilize cylinders at all times to prevent tipping. Be sure to use the appropriate regulator and follow all the necessary safety precautions when using an oxygen cylinder. Protect the patient by delivering oxygen in the concentration and method ordered by the physician. Following these basic guidelines, you will share in the responsibility to deliver oxygen safely and effectively.